Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. So today we are going to discuss about our skin health with focus on psoriasis. Now, psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, etc. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of test required for its proper diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Tushar Jagtap, who is a dermatologist practicing in Bandra East, Mumbai. He runs his own clinic called Dr. Tushar Zen Clinic located at 2 13 Amrutnagar, Kherwadi Road, Bandra East, Mumbai. Dr. Jagtap offers a wide range of dermatological services and products to cater to the varied requirements of his patients. He is highly skilled in his field and has received positive reviews from his patients on platforms like Rate MDs. He has years of experience in this field, and his skill and compassion have made a tremendous difference in patients' life. A very warm welcome to you, Dr. Tushar Jagtap.
Thank you so much.
It's a pleasure to have you, doctor, and more importantly, because today we are going to deal with a topic which is very important to talk about, psoriasis. होता क्या है, स्किन रिलेटेड जो इन्फेक्शंस हैं या जो दूसरी कंडीशंस हैं, उनसे लोग घबराते बहुत हैं और पहले पैनिक सिचुएशन में चले जाते हैं. उनको लगता है कि कहीं ये छुआछूत से तो नहीं होगा, और is it contagious or not, etc., etc. So it's better to get informed at the right time from the right person. So it's a privilege for us to have you with us today. To start, doctor, what is psoriasis?
Thank you so much for such a gracious introduction and briefs also which you started with. At the outset, let me wish you and all the platform and everybody who has joined a very happy new year. And the whole idea of having this discussion is recently I came across a patient and she had taken treatment for psoriasis from place almost for a year. And unfortunately, she took received some 30 odd injections for that in a year's time. And she really was on a wrong track because the medicine which was administered were not commensurate to her problem. And so I advise her that you better stop the treatment which you are taking from a very registered 30 injections in a year. It was such a, it was such a painful thing for me to see a patient who is suffering with psoriasis and who has taken treatment from a center which was not even if it is other countries, it's okay, but the side effects were so visible on the body. So I asked her to stop the treatment. But before we start, let me show you the photographs of what is psoriasis.
Sure.
I think like all the viewers to see this. Once you see, then you understand what is psoriasis. What does it do to the skin? Of course, to the nail also, the scalp also, and the joints also. So if you see psoriasis is chronic. Chronic means it's a long standing. It takes a lot of time. It's a chronic skin disease considered to be autoimmune in origin, and then there is a skin which are exfoliated, and that exfoliation is not in order. So what happens? The proliferation of the skin cells, they go haywire. And in today's language, I can say they get back fast track. Something which should happen between 28 to 30 days happens between 4 to 5 or 7 to 10 or 14 to 20 days. And that is why you see the skin. The skin becomes thicker You can see, we call it as a silver scale, and there is a pruritus. And if you remove this scale, then you will see a pinpoint bleeding points. And those pinpoint bleeding points are nothing but known as a peak site, and which is one of the diagnostic feature of psoriasis, which was discovered by Dr. Oswald, the Austrian doctor, way back in 1870 or 1880. So psoriasis is a chronic disease of the skin, especially it creates plaques, which are associated with 80 to 90% of the patient. Then you have various types of psoriasis, but they are red, dry, scaly, and they have an affinity for certain parts of the body. Especially you can see them on the elbows, on the knees, on the trunk, so and in the back. So this is a very common form of psoriasis known as plaque psoriasis. And that redness in psoriasis, the psoriatic lesion, is so visible that for a dermatologist, they can't beat it. But it does mimic many other skin conditions. So that is why detailed history, detailed history of the patient. In our college, there was a nice book called as Hutchison, a book for history taking. And in that, we used to take patients' past history, present history, family history, and his history of treatment taken in the past, history of current medication, or any other medication from other countries. That is very important in Mumbai state, especially in India, that we have so many different forms of treatment advised by so many people. And with the advent of social media, internet, Google, practically every alternate patient goes on Google and searches for his problem. And most of them they get scared. And as you rightly said in the introduction, that that there is a fear about psoriasis. And we are here today to dispel that fear. Thank you.
Absolutely. Absolutely. Now, doctor, as you said, it can affect anybody, and we are here to talk about it so that whatever panic, or fear is associated, we can correct it. Now, my question to you is that, who are the people who are at risk of having psoriasis? Initially, we have already spoken about that people, it's a immunity, related issue as well. So, who are those who are at the risk of having psoriasis?
In the risk factor, actually male to female distribution is almost equal, but female they go through so many biological events in their life, so it is slightly more in female, especially the same in the age group between 20 to 30, 20 to 50. But here I want to make one point, and the point is that if you see most of the health issues which used to arise after age of 40, so like getting a cataract or a graying of your hair, it used to happen late. But recently, last week, I came across a patient who is just 10 years of age, young boy, and he has got a psoriatic lesion on his left knee. So, psoriasis can occur at any age, but predominant age group is between 20 to 50. Now, who all are more susceptible to get it? It's commonly seen in families. It runs in families. So, the familial tendency, so genetic predisposition is seen in psoriasis. It's an autoimmune condition. Means your own body, for a part of the immune system, recognizes your cells as foreign and starts acting there. So there is an immunological uh, problem because of the psoriasis condition. Then there is environmental. And in the environment, you can do practically everything, what pollution, stress. Now in stress, I would say more than physical stress, it is mental and emotional stress that is more important in triggering psoriasis. Some medications like beta blockers we call it, and lithium, they can also trigger psoriasis. Too much of heat, extremes of climate, dryness, especially it is exacerbated in winter. I got a patient yesterday only, except when he said it comes only in November and December. He has got some psoriasis cavity. So environment plays a major role. Anything like smoking, excessive smoking, excessive alcohol consumption, improper sleep, late nights, fear, anxiety, they all can be a triggering factor as far as psoriasis is concerned. So these are common factors by which, and these are, and these patients, especially, they are more prone, not necessarily they should be, they are more prone to get psoriasis. Thank you.
Right. Now, doctor, a very common question people often ask regarding psoriasis, I'm sure you have heard it hundred of times, is that does it spread with physical contact through touch? Is it contagious?
Very important question. And you said rightly, and many patients, they have a worry that whether I could transfer it to somebody else, or even the other relatives, or they are also.
Right.
So psoriasis in one line is not contagious, not at all. It doesn't transmit from one person to another. So everybody who is listening to this discussion, they should carry this message. Psoriasis is not at all contagious. It is basically your own skin proliferation, which we call epidermopoiesis. Epidermopoiesis is till turnout time, maturation. So that is disturbing psoriasis. So the question is that psoriasis is not contagious.
Right. So psoriasis is not contagious. But doctor, very common practice in our society is to go for various therapies, home remedies, DIYs. These days, due to social media, there are so many influencers on various social media platform, and they love talking about skin. It's easy to talk about skin, and most of them are not qualified dermats, but then they'll suggest DIYs, and we are so obsessed with home remedies, DIYs, so we fall for it. So, do you also get patients who have, self-treated their condition for years and then have landed in front of you, and you often wonder if they would have come initially, they must have got relief way back. So, what's your experience on that?
Very true. I can tell you that initially we used to call it as a self-medication. Like people will go and take a medicine over the counter. Now, because of the reason, everybody is diagnosing, self-diagnosing. And this
Ah,
self-diagnosis is it's really a major issue because in skin, one condition can mimic so many other conditions. So most of the time, patients or those who are not well qualified to deal with conditions, they give medicine. I will give you an example. My friend came with me last week, and he showed me that he had some lesion on her leg, and he met one of his friends who is a surgeon, and he prescribed some medicine thinking it's a fungal infection. Now see, here is a qualified surgeon practicing for last 30 years. In good faith, he prescribed medicines to his friend's wife, and he thought it is a fungal infection. But no, not at all. It was diametrically opposite. It was not a fungal infection. It was what we call it the neurodermatitis, where there is a skin exfoliation, lichenification, and intense itching. So if this can happen to a qualified surgeon, think about common man or those who are dwelling into this without proper knowledge, aptitude, skill, and qualification. Self-diagnosis has landed many people in many problems. I will narrate one more example. One of my now he has become my friend. He was my patient and he was having getting repeated fungal infection. So one time I was thinking, what is that? What is your diet? And he said, doctor, he was 20 years old. I have stopped taking sugar. I said, why? And he said that I diagnosed, I feel I have got diabetes, and that is why I'm not taking. So I have a random blood sugar checking machine here. So I check and it says its sugar is quite low, less than 60. So I said, if you on your own stop sugar intake, it will reduce your body's immunity because you don't need to have, you are a young boy and you need to have proper diet. So he
Right.
was having fungal infection because he was not consuming sugar at all. So this can happen. There are many cases who have misdiagnosed themselves, self-medicated or take one medicine from the advisors, influencers on YouTube, WhatsApp, Facebook, or any other channel, and they are landed into big problem. So I would request one and all, please visit your neighboring dermatologist or a doctor. Ask him all the questions which you want to ask. Yesterday, the patient who came, he asked me last week not less than 50 questions. This is how we would guide you. Wherever you go, with your specialty, with your faculty, we have to respect people who have got knowledge, experience, and who can understand the gray area. Medicine is not 1 plus 1 is equal to 2. What is suited for X patient may not suit Y patient. What relieved his pruritus did not work in Y's case,
Absolutely.
which he gave it to her, thinking it would help her. So I
Hmm.
would request all those who are on the platform that self-medication and Google-driven knowledge. Yes, it is very useful. I don't say it is not useful. It is useful, but how to interpret that knowledge? Today, the whole
Absolutely.
world is like open book. We all can
Yes.
find out from any about anything, like from astronomy
Hmm.
to from space science to any science. You just have to go type keywords and you get the information. The whole idea is that how to interpret that and apply.
Right.
Thank you.
Absolutely. Completely agree with you on that. So, the bottom line stays that in case you have anything which is bothering you on your skin, on your scalp, on your nails, please go and consult the right person, which is a qualified dermatologist. होता क्या है, मान लीजिए हमें अगर चेस्ट पेन हो रहा है तो क्या हम ओवर द काउंटर मेडिसिन लेते हैं? तो क्या हम कोई होम रेमेडी करते हैं? नहीं, हम डॉक्टर के पास जाते हैं क्योंकि हमें लगता है कि इससे हमें जान का खतरा है। लेकिन स्किन को हम थोड़ा उस तरह से ले लेते हैं, बहुत सीरियसली कई बार नहीं लेते हैं, उसमें बहुत एक्सपेरिमेंट्स करते हैं, एंड बाय द टाइम वी गो रीच एंड टेक एडवाइस फ्रॉम अ डॉक्टर वी रियलाइज दैट इतना वक्त हमने ऐसे ही जाया किया, पहले चले जाते तो आराम बहुत पहले मिल जाता। तो प्लीज डू नॉट फॉल फॉर एनी ओवर द काउंटर medication, various endorsements, promotions. Go to the right person, which is a qualified dermatologist in case of psoriasis. Doctor, there are so many myths also associated with psoriasis. एक बहुत common myth जो हम सुनते हैं बचपन से वो ये कि मछली खाई है इसके बाद दूध नहीं पीना है. I'm sure you also come across various, things people normally associate with psoriasis. Would you like to shed some light over various kinds of myths and the facts?
Oh, yes, you're right. There are so many myths we have, and patient can associate that particular incident to this problem. And I'll give example of when Bombay had a flood. I think it was in 2005. The entire city was flooded, and people waded through that dirty water for a couple of days. Many patients still come and attribute that after that particular incident, they have developed this. So there is a possibility something will get registered in your mind, then the mind attributes it to this. Many of the times it will not be true, but we have to trust the patient, we have to believe the patient because the patient he actually gives us the clue. So if there is some triggering event, right? Psoriasis don't get triggered after you get a cut or a skin injury. Psoriasis can get bigger after the upper respiratory tract infection, especially with streptococcal. Psoriasis can be triggered after taking certain medications. Like there are medications, anti-malarials, which can trigger this problem. Psoriasis get triggered after bereavement, emotional trauma, mental agonies. After few months after that, psoriasis get loss of your beloved can trigger this problem. So stress is very important. Some triggering factors do happen, but we have to take everything with a pinch of salt before coming to the conclusion whether what patient is narrating, we consider that as maybe a myth, whether there is a substance in it, and then accordingly guide the patient. Right?
Okay. Now, doctor, when a patient comes to you, as you said already that, you take complete history of the patient to, to get to the root cause. But are there any tests that you normally recommend to find out whether it's psoriasis or not, or what's the cause, etc.?
Very important. Very important. In psoriasis, the investigation of choice is a skin biopsy. And skin biopsy gives us a perfect picture about what this disease, whether it is whether it is psoriasis or whether it is any other problem, like say eczema or any other. So skin biopsy is the drug of choice, especially if a patient has say psoriasis capitis, then isolating from the infection is also important. If a patient is having psoriatic arthritis, then the X-ray of the joints will help us to understand whether it is psoriatic arthritis. Most of the time, the skin lesions are associated, so the diagnosis becomes quite easy. So this couple of investigations, and then there are say if you go to a medical college or hospital, and there are so many tests which can immunological tests which are done to diagnose psoriasis. But for the trained eyes, skin biopsy is the investigation of choice. Thank you.
Right. Now, doctor, because you mentioned skin biopsy, and we know that skin biopsy has got nothing to do with the biopsy that normally we hear regarding, cancer or to find out malignancy. Because you are here, would you like to shed some light? Because people get really scared when they get to hear that they need to go through a skin biopsy. So, if you can just tell us what is skin
Skin
biopsy.
biopsy, if it is skin, it's very important. That biopsy is the simplest of the procedure. After the patient consent and after explaining the patient what it is about, it's a very we do a local anesthesia at the site of the site at the site from where the tissue is to be removed. And we have a 2 millimeter, 3 millimeter, or 5 millimeter skin biopsy point. And to that we remove the tissue bit. It's a very small tissue bit which we make. And then it is sent for the pathological examination. So I will tell all patients or everybody who is on this platform listening or otherwise also that skin biopsy it is not fine needle aspiration biopsy, FNAC, which we do in some hematological problems or lymph node biopsy. So it is one of the simplest, easiest OPD procedure can be done in the OPD. And patient should, if the doctor advise patient to undergo skin biopsy, I think you should please follow his instructions.
Right. Now, doctor, what are the treatment options available for psoriasis?
Psoriasis treatment, I tell you, see, this is important that the people get scared. I just started in the introduction. Don't get scared. First and foremost, today we are here to remove that fear from the minds of the people that about psoriasis. Psoriasis is treatable. So many new medications are coming, advances are coming. You will have a period of remission. And I can go further and say that if you see the entire literature, they say no, there is no cure for it. I can say what is cure? Cure is a very ambiguous word. Yesterday I got a patient who had a geriatric scabies. Now that patient after proper treatment will get alright in 8 to 10 days. After few months or after few weeks he might get scabies. So there's a recovery. So what does it mean? That he was not cured at the first instance? No, he was cured. Similarly in psoriasis, people talk about remission. I in my practice I can tell you that I have been fortunate that almost 90% of my patients, they have had episode of psoriasis. And now for say 25 to 30 years, they don't have any of the lesions. So what do you call it? Huh? So this is a very ambiguous term. So on mail, if they say they find that it is not curable, in my opinion, yes, it is curable. And people may challenge me on that, but I'm ready to take the challenges and define this word, what is pure.
Right.
So it is pure. Now I'll tell you what is the treatment.
Yes.
The treatment is first and foremost, if you see those packets, I would again show the packet.
Yes.
These packets they are dry, they are inflamed, they are red, and then the pruritus. So what do you do? The commonest thing you have to apply moisturizers.
Okay.
The more you hydrate the psoriatic lesion, the less trouble it will be used. Moisturizer, moisturizer, moisturizer as the first line of treatment. Second advice, second advice is apply a corticosteroid cream as per your medical advice.
Hmm.
The corticosteroid comes in various forms: mildest, mid potency, and a high potency. Now saw that young boy, 10 years old. I give him a mildest form of this thing, uh, steroid cream, which should help him. So moisturization, mild, moderate or high potency corticosteroid cream or ointment lotion should be used. Then there are other molecules, vitamin D analogs, which can be used here. Even you have calcium inhibitors that can be used, like here tacrolimus or biologicals, local biologicals. They are also can be used here. Coal tar is there, anthraline is there. There are various local treatment which is available. After that, you have something known as phototherapy. So ultraviolet B phototherapy, especially narrowband 311, it helps the patient. Simplest form of treatment, quite easy to take, and good results. You get in mild to moderate psoriasis. After phototherapy, you have oral medications. In oral medication, there are many medicines, especially which helps to get over the inflammation. So what is inflammation? In psoriasis, there is inflammation at the side of the skin. There is a redness, there is itching, there is swelling, you know. So you have to get over that inflammatory cascade. You have to deal with this pathology of psoriasis. So where do you, what medicine should you use, and where it will help, whether it will block the pro-inflammatory cytokine. Cytokines are proteins which are here. If you look in 2317, they are involved.
Hmm.
Then TNF alpha. So many biologicals or methotrexate or cyclosporine or acetretinate, they are used to block the specific mechanism depending upon the patient's age, his past history, and the severity of the we call it psoriasis past score PASI, that is psoriasis area and severity index. So it all so there are oral medications, there are local medications, and it helps the patient. But what
Right.
helps most is, and this is what I wanted to talk here, is
Yes.
PPT, that is cognitive behavioral therapy, NLP, that is neuro linguistic program. So what is this thing? It is, see, in psoriasis, the patient is really fed up because of the chronicity of the illness, chronicity of the problem, irritation, different medication he receives. And there is one thing which the patient always says, it come what may. Some patients they say, I'm ready to spend n number of money, but I want to get rid of it for once and for all. So this concept of getting rid of something for once and for all, it doesn't work in certain conditions. And psoriasis is one of those conditions. One has to do is that you have to accept and give a
Right.
major response. Psoriasis is treatable if the patient, his ecosystem, and the medical ecosystem and the doctor, if they work together.
Right.
Thank you.
Okay, doctor. And doctor, many people are asking because you also mentioned that vitamin D also plays an important role. So people are asking our viewers that does sun helps in the management of psoriasis?
Very much. Vitamin D is one of the causes. If you have a low vitamin D level, that can trigger psoriasis. So vitamin D supplement does help. So vitamin D, vitamin D is not in skin maturation also, and vitamin C as an antioxidant plays a very important role in subsidizing the or giving relief in patients with psoriasis.
Okay. There is one more viewer, Sana. Her question is, how can I, with psoriasis, take care of my skin?
Does she have psoriasis?
Yes.
And what would be interesting to know is where are the lesions, which part of the body, and she can very well take care of it. I can assure her from this platform, she has to follow just few tips I'm giving her. Do exercise regularly, hydrate yourself properly, take good sleep, don't think too much. Overthinking is a major problem today in Mumbai. I see, and overthinking complicate the problem. It increases, instead of getting relief, patients may get more problems.
Okay.
She can do mindful meditation. Meditation is simple. I tell my patient just sit your eyes, close your eyes for one full minute and relax and do that at least 2 times a day. Plus visualize. I can tell her that mind meditation or just using relaxing techniques, she would get more than 50% benefit. She can hydrate her lesions properly, use a right moisturizer, and she has to be quite positive. It's going to go. Let's talk to yourself. It's going to go. You will get into state of remission. You will not have these lesions. Since it is not contagious, there is no need to worry about it. But psoriasis will be cured only when if you start addressing it positively, being the present. Don't be too much in the past. Don't be too much in the future. Don't catastrophize. Fear, anxiety, nervousness, depression, they are trigger for increasing your lesions. So just try and relax. Meet a good doctor or counselor or PT. Take your treatment properly. And don't please don't worry too much. What is the definition of anxiety? Is a fear of something or someone repeatedly, which comes the fear of something or someone by which you feel you are worried or there is a fear. So repeatedly those thoughts, rumination complicates the reality. So just relax and you should be definitely all right. Thank you.
Okay. We have Gopal with us. His question is, can psoriasis affect the joints?
Yeah, very much. Very much. Psoriasis does affect the joints. And that is what we call it as psoriatic arthritis. There is an inflammation, there is a stiffness, there is swelling, and there is some severe cases, there is a deformity also. So psoriasis affects many. See, it is associated with metabolic syndrome. That is hypertension, diabetes, hypercholesterolemia, obesity. So psoriasis is not only a disease of the skin, it is a disease of the internal organs also. It affects nerves, it affects joints, it affects so many parts of your body. And it is associated with your gut microbiome also. So I want to say, lead a very understand what is gut microbiome. See, our gut produces serotonin, which is a hormone which gives us you feel nice. After dopamine, serotonin, they are very important. Eat the right kind of food, vegetable, fruits. They are the mainstay treatment. Omega-3 fatty acids. That's very important. And it does affect joints. There are multiple types of psoriatic arthritis. We see single joint involvement, multiple small joint involvements. So how to take care of that is first take care of your thought process, your lifestyle, and your approach. Thank you.
Definitely. And doctor, is there anything that we have missed upon that you would like to add or talk about psoriasis? Nail psoriasis is also something, which people often ask that
Yeah.
how much
Male
time.
psoriasis, male psoriasis is very common. Psoriasis capitis, especially we say it is dandruff, but then many patients they have a involvement of the scan, round patches, and if you scratch that, then the flex comes out. So for that, you have to use the right kind of a shampoo
Okay.
and take care of your skin. Universal precaution is in psoriasis. What I will say that do expose yourself to sunlight, take a detour, relax, take it easy, take apply moisturizer on your psoriatic skin. Don't worry and don't try to people want to get over this disease as fast as possible. That is excellent. But sometimes slowing down, reducing our expectations will help you to get it clear. So approach towards your skin problem, very important. Then sometimes patient is really irritated. Cost is also there. But I can suggest take it easy. And doctors and patients should spend at least 25 to 30 minutes discussing about this. And what is important in most of the time, what happens is that I give advice to someone, or someone gives advice to me. If it is even if it is my interest, there is a possibility that I may not take that advice, even 10%. And that is the problem. If any one of us ever in any type of any type of situation, if we get a right kind of advice, please take it and please follow that. Unless you take action on that advice, you may not get a desired result. So my request is that even if somebody guides me about something, I should take it seriously and do whatever bit I can do so that it helps me. And so that is especially please listen to what the specialist advise you. Please follow that. If you follow that, I'm sure you will get definite results in psoriasis. So many medicines are there. They have such a beautiful medicine. This biological, we have changed the scenario in psoriasis. And
Right.
if you come to the terms with it, work on it. It's definitely you get a nice result. Thank you.
Right. So you need a positive frame of mind to deal with the whole situation. Consult with the right person, which is a qualified dermat in this case. Do not panic. Do not fear, of course. Seek advice, of course, from the right person and stick to it. You'll definitely get relief. Now, Doctor, we are on the verge of concluding the whole session. Any brief take home message for our viewers?
Um, Psoriasis, I would say anybody who suffers from psoriasis or you know someone is suffering from psoriasis, first and foremost, now we are into 2025. Have some guidelines that how I'm going to approach my skin problem. Once you understand the diagnosis that it is psoriasis, do not worry. You have to take care of it, you have to manage it. So as I said, moisturizing psoriatic lesions are very important. Applying relevant creams are also very important. And lifestyle changes. See today, most of the most of they are running, their mind is never at rest. You have to allow your mind to rest. And for that, the best treatment is relaxation technique. If you follow relaxation techniques, if you work on yourself, and if you don't get panic and follow the advice which is given by the doctors, I am very sure that you can deal with this problem, and psoriasis will go into long time remission. You may never experience psoriasis in your life. Not this is
Right.
what science says. I'm saying that take everything with a pinch of salt, but psoriasis is treatable 100% treatable, and you get good results provided you and the medical specialist or your ecosystem and your ecosystem, they are conjointly works together and works for the betterment of the patient. Thank you so much.
Thank you so much, Dr. Tushar Jagtap. It was wonderful talking to you, sir, and thank you for your valuable time and making this session so informative. Thank you. It was
Thank you
great
so much.
hearing you.
Thank you so much. Thank
Thank you, Doctor. And viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.
thank